I think I'd rather see you. I'll push that one. There we go.
So how have things been? I know we kind of been talking a little bit, but where are we at? How is the knee feeling?
The Reader's Digest version is, of course, Thursday after we got done, it went ballistic. Friday was pretty good, probably pain level 5 all day. Saturday, to be honest with you, me and my son came down, and we pretty much just drank all day. So I don't know what the pain level was. Sunday was fine until I iced it. When I iced it, it just went ballistic. Felt like somebody was stabbing me in the knee over and over and over.
Mm-hmm.
Rest of the night, and then yesterday was tolerable. Probably seeing patients, it was probably up around 6 or 7, but I could handle it. It was fine all night last night. Slept fine. Woke up this morning, tensed it, and then sorry, my one of my massage therapists keeps trying to call, and I'm just declining the call. Woke up this morning, it was fine. I tensed it because it was a little sore, and then I put ice on it, and it went nuts again, and went ballistic. I mean, it was killing me this morning. So I'm learning not to ice it anymore, that's for sure. Did PT this morning. It feels nice and tight and strong, but it's been about a pain level 6 or 7 seeing patients today.
Okay, so it seems like, before we did our first session, you're basically 10 out of 10 pain for a month straight.
24/7, yeah.
And
yeah, there's
now
improvement.
you're fluctuating between moments of no or little pain and then increased pain, 6 or 7. But a lot of times you're about a 5. Did I hear that about correctly?
You heard correctly.
Cool. All right, well, let's kind of get into it. We making good progress. You're already seeing that, you have a major surgery, as you've been told, and we're still able to get you moments of pain-free or days of pain, periods of being pain-free. So now we're working on stability and anything else that might be getting in the way of that. So any last comments before we get started?
No, not really.
All right.
If I had any comments, it would be on just the zone technique, but we can work about that later sometime.
Okay. Yeah. Whenever it's relevant, just toss it out there. So we're gonna start with your zone. We're doing zone 5 today. Okay. So as you know, that's the part of your brain that controls all the muscles, all the tendons, all the ligaments, bones, and joint. So that's what we're working with, the knee. Everything in there.
Right.
So I'll have you go into your kind of quiet, meditative-like state for a moment.
Tell you what I'm going to do. I'm going to turn off this light. There we go.
Okay, I'll have you take a deep breath in and let it out. And on your exhale. So now we didn't really do our official kind of before and after thing. So with sitting there prior to the treatment that we just did you have any pain, or was it only on standing?
Just on standing.
And where would you have been at the beginning of today's, before we started talking?
When I was walking around closing things up, as I was walking around, I said, it's about a 7.
7. Okay. Stand on up and let's see where we're at right now.
I'd say 5 or 6.
All right. Let's see. I'm gonna take something in a little new direction. All right. So I want you to do something for me. So I want you to close your eyes.
Okay.
And I want you to. Now, this is gonna be just first reaction. I don't need you to think there's any rhyme or reason to this. When you think about this knee pain and discomfort that you're in, what's the first color that pops into your mind?
The first color?
Yep.
Red.
Red, okay. So what I want you to do is, to the best of your ability, just see green energy filling that knee up. It's coming from wherever it's coming from the heavens. You can imagine like a little sun, a green sun radiating into the knee, just filling up that knee totally and completely. And let me know when you feel like that knee is totally full with that green energy, or to what you know to be the green energy if you can't see it.
For some reason today, I'm clearly getting purple energy.
Good. Hey, shove that green energy in there instead.
There it is. I see it. Okay.
Very good. And just fill that knee up totally. And once that is fully filled with that green energy, then let me know. So take your time.
I think it's full, but it's like just throbbing.
Yep. That's what we're looking for. So now what I want you to do is, now I just want you to imagine, like, if you could just breathe this green energy straight into your heart. Just imagine you're doing that.
From the knee or from the source?
You can go right from the source right to your heart.
Okay.
And as you are breathing that into your heart, just see, your body in your mind's eye. Just imagine, see it. It's kind of going into your heart, and that's distributing it throughout your entire body. And then let me know when you feel like your whole body is just filled with this green energy. Or you may just feel complete, even if you can't see it exactly.
Okay, I'm there.
Cool. So when you're ready, come on up and let's see how much better that knee's doing now.
I'm 4 or 5.
4 or 5, okay. Cool. Color, I don't work with colors too much just because it's so, you can't touch it, right? Kind of thing. Like, my office, I'm used to be like adjusting somebody. So I don't really play with this stuff too much, but colors are just let you know vibration's different. And if we can take the opposite vibration, that will help cancel that out. That's how noise canceling headphones work.
Okay.
There's the vibrations will cancel each other out, and that's why you don't notice any noise. We can do the same thing with the vibrations and sensations of pain in the body. So now I want to work with, and by the way, you can send that green energy to your knee whenever you want.
Right.
So just whenever you feel called to.
actually used this technique with a patient the other day.
Oh yeah,
Yeah.
very cool.
Every time I adjusted her wrist, she wanted me to adjust her wrist. Every time I did, it hurt like hell. And I said, well, I want you to imagine when I adjust your wrist, every time you hear a release, that a gold color healing energy is just running straight in there. And after she did that, she's like, you know what? That worked.
All right, and you know our policy. If it works, we love it, right?
That's right.
All right, we're gonna check to see if there's any other emotions that need to be brought up that's not allowing that need to be quite stable yet. Okay, so we're gonna be clearing out the emotion of terror. We don't need to know any details. So I'll have you close your eyes when you're ready. State or set that intention internally. I'm now ready to release any emotions of terror. And see that purple color that you can see in your mind now, flowing into your body, and you're going to breathe it into your body when you're ready to begin 2 times. And actually breathe that all the way from the top of your head, all the way down through your spine, all the way down into the knee. And then the exhale, go from the knee all the way up and out, doing that 2 full times.
Okay.
Very good. All right, hang out there for a second. Okay, so that's the only emotion that we wanted to release today. So come on up and see how that knee is doing.
Now it just feels tight.
Good. No
Not
pain?
really hurt. Not really hurting, just tight.
Good.
Because it was hurting pretty good.
Okay. All right, cool. So let's kind of leave it there today, and then we'll pick this up again as we need to next time. So ultimately, you know, we're getting you to periods that you're pain-free pretty quickly. You know, first time it took, you know, 20, 30 minutes. This time it took closer to like 10 or so. So you can see these things are clearing out faster, and your times of being stable, meaning there's no pain and you're keeping it there, is going to get longer and longer until your body doesn't have that anymore, right? As it's taking care of the healing on its own.
Yeah, because I can definitely tell the difference since we did this last week.
Very good.
Yeah.
So on that note, any other, I know you had a couple questions about zone stuff, but anything particularly connected to the knee before we move to that topic?
No, I'm happy with what we're doing. I don't want you to think that I'm not when I said something about, oh, it's killing me. I mean, I'm trying to look at the better things that are happening. Like you said, it's not 24/7 anymore. It's probably 3/4 the time hurts, which is, hey, that's improvement, you know?
Yeah.
And it doesn't seem to hurt at
one
night
session,
anymore.
you know, like you've been dealing with this for 4 weeks, so this is great progress. You know, we like to see miracles like, boom, it's done. And we really kind of got a little bit of a miracle. It just, we need that miracle to stabilize.
Oh, yeah.
And that's what we're working on.
Hey, as long as I can sleep at night, that's a blessing in itself, because sleeping at night was a major pain in the butt.
Yes.
Any twisting, moving at all that the knee just wants to do this. It doesn't want to go rotate. And when you're sleeping, you're crossing your leg, and that was killing me. So now it's pretty good. So it's good.
Excellent.